Acetazolamide is a medication that can be used to prevent and reduce the symptoms of altitude sickness, such as headache, tiredness, nausea, dizziness, and shortness of breath that can occur when you climb quickly to high altitudes. It is particularly helpful when you cannot make a slow ascent. The best ways to prevent altitude sickness are climbing slowly, stopping for 24 hours during the climb to allow the body to adjust to the new height, and taking it easy the first 1 to 2 days. Acetazolamide is also used to treat high pressure inside the eye due to certain types of glaucoma, and to decrease a buildup of body fluids caused by heart failure or certain medications. It can also be used with other medications to treat certain types of seizures. It is important to note that acetazolamide may work less effectively over time, so it is usually used only for a short period. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. If you are taking the tablets, take this medication by mouth as directed by your doctor, usually 1 to 4 times daily. If you are taking the long-acting capsules, take this medication by mouth as directed by your doctor, usually 1 or 2 times daily. Swallow the long-acting capsules whole. Do not open, break, or chew the capsules. Doing so can destroy the long action of the drug and may increase side effects. Acetazolamide may be taken with or without food. Drink plenty of fluids unless otherwise directed by your doctor. The dosage is based on your medical condition and response to treatment. To prevent altitude sickness, start taking acetazolamide 1 to 2 days before you start to climb. Continue taking it while you are climbing and for at least 48 hours after you have reached your final altitude. You may need to continue taking this medication while staying at the high altitude to control your symptoms. If you develop severe altitude sickness, it is important that you climb down as quickly as possible. Acetazolamide will not protect you from the serious effects of severe altitude sickness. If you are taking this drug for another condition, such as glaucoma, seizures, use this medication regularly as directed to get the most benefit from it. To help you remember, take it at the same times each day. Taking your last dose in the early evening will help prevent you from having to get up in the middle of the night to urinate. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. When used for an extended period, this medication may not work as well and may require different dosing. Your doctor will be monitoring your condition. Tell your doctor if your condition does not improve or if it worsens. This drug may reduce the potassium levels in your blood. Your doctor may recommend that you eat foods rich in potassium, such as bananas or orange juice, while you are taking this medication. Your doctor may also prescribe a potassium supplement for you to take during treatment. Consult your doctor for more information. Tell your doctor if your condition lasts or gets worse. When taking acetazolamide, you may experience dizziness, lightheadedness, increased urination, blurred vision, dry mouth, drowsiness, loss of appetite, nausea, vomiting, diarrhea, or changes in taste. These side effects may occur especially during the first few days as your body adjusts to the medication. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as tingling of the hands/feet, hearing loss, ringing in the ears, unusual tiredness, easy bleeding/bruising, fast/irregular heartbeat, muscle cramps/pain, new or worsening eye pain, decrease in vision, mental/mood changes, signs of liver disease, signs of kidney problems, or signs of infection. Additionally, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA. In Canada, you can report side effects to Health Canada. Before taking acetazolamide, make sure to inform your doctor or pharmacist if you have any allergies or if you are currently taking any other medications. It's important to discuss your medical history with your doctor, particularly if you have adrenal gland problems, mineral imbalances, kidney or liver disease, breathing problems, diabetes, gout, glaucoma, or an overactive thyroid. Acetazolamide can help your body adjust to high altitudes and quick climbs, but it may not completely prevent serious altitude sickness. If you experience severe symptoms such as shortness of breath, confusion, lack of coordination, extreme tiredness, or a severe headache, it's crucial to descend to a lower altitude as quickly as possible to prevent any serious problems. This medication can cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana while taking acetazolamide, as they can make these side effects worse. You should also be cautious when driving or using machinery until you know how this medication affects you. Acetazolamide can affect your blood sugar levels, so it's important to monitor your blood sugar regularly, especially if you have diabetes. It's also a good idea to carry glucose tablets or gel with you in case your blood sugar drops too low. If you experience symptoms of low blood sugar, such as sweating, shaking, or fast heartbeat, be sure to treat it right away and inform your doctor. This medication can make you more sensitive to the sun, so it's important to limit your time in the sun and use sunscreen when outdoors. You should also inform your doctor if you are planning to have surgery, as acetazolamide may interact with other medications. If you are an older adult, you may be more sensitive to the effects of acetazolamide, especially dizziness and lightheadedness. If you are pregnant, discuss the risks and benefits of taking acetazolamide with your doctor before using it. If you are breastfeeding, consult your doctor before continuing to breastfeed while taking this medication. When taking acetazolamide, it's important to be aware of any potential interactions with other medications you may be taking. Some products that may interact with this drug include lithium, memantine, methenamine, orlistat, and certain drugs used to treat seizures such as topiramate and zonisamide. It's also important to check the labels on all your medicines because they may contain aspirin or aspirin-like drugs, which can cause serious side effects if taken in large doses with this medication. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Additionally, some products have ingredients that could worsen your swelling. Be sure to tell your pharmacist what products you are using, and ask how to use them safely, especially NSAIDs such as ibuprofen and naproxen. It's also important to be aware that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know that you are using this drug. As always, it's important to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, seek immediate medical attention by calling 911. You can also contact your local poison control center for assistance. In the U.S., the number for the Poison Control Center is 1-800-222-1222, and in Canada, you can call a provincial poison control center. When taking acetazolamide, it's important to stick with the same brand and dosage form, unless your doctor or pharmacist advises otherwise. Different forms of this medication may not work the same, so it's essential to follow their guidance. It's also crucial not to share this medication with others, as it is prescribed specifically for your condition. While using acetazolamide, your doctor may request lab and/or medical tests, such as complete blood count, potassium and sodium levels in the blood, and liver function tests. It's important to attend all medical and lab appointments and consult your doctor for more details. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions to ensure the maximum benefit from this medication. If you forget to take a dose of acetazolamide, take it as soon as you can. But if it's almost time for your next dose, just skip the missed one and take the next dose at your usual time. Don't take a double dose to make up for the missed one. Remember to store acetazolamide at room temperature, away from light and moisture, and be sure to keep it out of the reach of children and pets. It's important to not flush this medication down the toilet or pour it into a drain unless instructed to do so. When you no longer need it or when it's expired, be sure to properly discard it. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.